I would like to now invite Dr. Sandeep Bhalla. He is an alumni of Armed Forces Medical College and has several publications, especially he is working with the Public Health Foundation of India, and several of us as doctors would have taken his e-learning courses. Welcome, sir, to our session, and he'll be speaking to us on capacity building in chronic health conditions.
Respected chairpersons, Mr. Lal from Chelaram Diabetes Institute, the founder of Chelaram Diabetes, Dr. Unni Krishnan, sir, and whole family of Chelaram Diabetes Institute. It's really a great honor and privilege that you have given the opportunity to PHFI. Again and again, you're giving since 2017. This is the third summit. And in the first summit, when Chelaram Diabetes Institute has organized, the chief guest was none other than but the president of Public Health Foundation of India itself, Professor K. Srinath Reddy. So thank you, all of you, for keeping us also into your minds. My talk is going to be a little bit different from the clinical talks. You all are going to go through these 3 days, whole clinical scenario of diabetes. But at the back, there is another scenario which is going on in exhaustive way and where there is a dire need, that building the capacity. I'm not here to criticize anybody. I'm not here to boost anybody. But there is a need which has come, that the manpower shortage in dealing with this epidemic of diabetes, we need in huge force. It is not only the specialists, it is not only the people, those who are into the tier 3 cities and metro-centric places, but ultimately the population, if you see the diabetic population, 70% still are moving to the remote places they are staying. And who is the person to whom they are meeting? They are meeting the primary care physicians. So ultimately, there is an onus to all of us that there should be something to upgrade their skills for primary care physicians so that they should be equipped enough at the primary care level to deal with such type of chronic conditions. So this is the background of my presentation, how the Public Health Foundation has thought about this process and where the Public Health Foundation of India stands today with eminent partners like Chelaram Diabetes Institute, which is one of our eminent partners in 2 eminent programs which we are running in India and which has taken up a global shape now. PHFI as such is a first public health tank created by the Ministry of Health and Family Welfare. And the purpose of this tank is to act as a catalyst in the field of public health. We have a very strong board of Public Health Foundation of India. It has been chaired by Mr. Ramadurai. And we have Health Secretary on the governing board of PHFI. And eminent names, you say, from the industry, from the Tata industry, from the Godrej industry, people like Dr. Abhay Bhang, people like Dr. Maharaj, Dr. Abhay Bhang, Dr. M.K. Bhan. They are eminent people, those who are the governing board members of PHFI, and the founder president is none other than but Professor K. Srinath Reddy. We are into training, education, affordable health technologies, communication and policy development, and under the umbrella of PHFI, we have various Indian institutes of public health. And through these institutes, we are running various postgraduate diplomas, trainings, providing the assistance to the state governments to strengthen their health systems. When you people, there is a branch in medicine known as community medicine and preventive and social medicine. We all know what is PSM and what is community medicine in the medical colleges. But this particular organization has changed the scenario of public health globally. Public health means health of a public, which everybody has an onus to work in that sector, and that is what the body has created. We have 4 centers of excellence, and there is one center that is Center for Chronic Conditions and Injuries. The focus of the center is to work in the field of chronic conditions capacity, research, and policy. And this center is headed by Professor D. Prabhakaran, who is the Vice President of Research and Policy of PHFI. If we are talking about chronic conditions, why there is a shift which has happened from last 10 to 15 years. We always talked about communicable diseases 15 years back, and there is a drastic shift which has happened because of the epidemic of the chronic conditions which have come up in a very big way. Other than that, all the national, international scenarios are talking about the chronic conditions now. Why? The reason is Being chronic, out-of-pocket expenditure is going to be huge, and the economic burden on each and every country is going to be huge. That's why at the highest policy level, everywhere the talk is going about on chronic conditions. On the other hand, if you see, there is a shortage of professionals available. It is not that we have enough number of professionals, not only in India, but all across the globe. If you see, the shortage is there. There is lack of availability of on-job training initiatives for these professionals, which can equip them to deal with these chronic conditions. And there is an absence of standardized teaching protocol. If things are available, then there is no standardized teaching methodologies and teaching patterns are available. So keeping this in mind, if you see, there is a huge change. Medical knowledge has increased in a very big way since last 15 years. Change in treatment guidelines, change in patterns, it has happened. But on the other hand, the capacity building portfolio has not done in that way. So there is a huge gap. To fill up this gap, PHFI has put up the focus on primary care physicians, keeping in mind that they are backbone of the tertiary care centers. They are the first line of contact, and ultimately they are going to act as a good referral mechanism. Because at the primary care level, if you can diagnose the people at the level, and if you know the complicated cases are there, then only you should refer the patient to the tertiary care center. It will ultimately reduce the load to the tertiary care centers also. The journey started, you can see this slide. In 2010, it was only one, that is CCEBDM. CCEBDM is a buzzword now in the field of diabetes sector globally, not only in India. That is a certificate course in evidence-based diabetes management. I'm sure that a lot of our senior colleagues, medical colleagues, those who are here, I am sure that a lot of people have already gone through some of these initiatives, and we have very eminent faculties already available. My previous speaker, Dr. Abhichandani, he has been associated with us since 2010 as an eminent faculty for these initiatives. This particular course has created a landmark in India, and it has created a journey of capacity building. And now we have a foray of courses. You say gestational diabetes. Our partnership with Chelaram Diabetes Institute started with cardio diabetes course, where the people, Dr. Vedavati Purandre and their colleagues, Dr. Shailesh Deshpande, under the leadership of Dr. Unnikrishnan, they have worked extensively on the course curriculum. These are very structured courses, and we have a stall also at the back. If you can see, go straight and turn to the left. All the things are available. You can go through that. We have an initiative on diabetic retinopathy. Ma'am, you're an ophthalmologist. This is the initiative. We were thinking that primary care physicians has no role in diabetic retinopathy. And this demand has come from none other than but Queen's Elizabeth Trust based in UK. They said blindness, diabetic retinopathy is one of the major cause, neglected reason for blindness. They have invested the money for India to initiate a course on diabetic retinopathy, and PHFI is acting as an implementing partner in collaboration with Dr. Mohan's Diabetes Academy and Arvind Eye Care. And we were surprised to see that the physicians, not only physicians, but some ophthalmologists are also joining, and they are doing this initiative. We have a course on thyroid disorder. We have a course on hypertension, COPD and asthma, certificate course on CVD and stroke. And today there is an International Women's Health Day. I am here to announce to you that we are coming up with a new initiative, that is the Women's Health course with Dr. Usha Shriram Group and Foxy. That is a new initiative which is in pipeline, and this year it is going to come up. It's a 6-modular course. We have a course on healthcare quality also. The purpose is to build up the capacity of these physicians and to create the network. What is the model? How this model has become a landmark model, not only in India, but other countries are now taking it up. There are three partners. One is the implementing partner. At the back, Public Health Foundation is implementing these courses all across country. We started with 100 centers. Center means Chelaram Diabetes Institute can be one of the center. Other than that, you can see now currently we have more than 550 centers all across India. It is not that tier 1 cities are only having, but tier 2, tier 3 and tier 4 cities are also cities like Nagarkoil, Kakinada, Devariya. We have centers in interior to interior places so that the primary care physicians can get the standardized teaching protocol from the faculty all across country with the standardized material which has been created by the eminent academic partners. as well as vetted by the panel of the national experts like Dr. Amrish Mittal sir is going to be here tomorrow, Dr. Nikhil Tandon from All India Institute of Medical Sciences, Dr. Anil Bhansali from PGMR Chandigarh, Dr. V. Mohan himself as a national expert as well as an academic partner, Dr. Unni Krishnan sir himself as an academic as well as national expert in some of our courses. These people have vetted that course curriculum after getting it from the academic partners, so that tomorrow there should not be a bias in the curriculum. It should not be that it's a CDI's course or it's a Dr. Mohan's course or it's a Arvind Iyer course, but it is a course which has been taken the consensus from the eminent people sitting in the policy, from the Government of India national programs, and they are giving the inputs, and it should encompass all the pattern which are needed for the primary care physicians. So these people we have created a panel of national experts. Then the challenge was, who will deliver this course? That was challenge in 2010. I think Dr. Abhichandani must be knowing very well. First time when we started, it was very difficult to convince the respective faculty that we want your leadership to impart these teaching material to the respective primary care physicians in your own areas, in your own cities. The first challenge was, why I should do? Second challenge was, too much time you people are asking. 1 year, once in a month. The issue is, this is a course which is very convenient for the doctors on-job training, once in a month, on a respective Sunday, at your own places, 4 to 5 hours, with a systematic course curriculum, lot of case studies, lot of group work exercises. It is not didactic sessions, but it encompasses more interactive sessions with the help of the faculty. Why we were looking for the faculty, though the things are available in Google today. You Google it, you will get all the things. But the experience which these respective faculty are going to impart to the participants, to the physicians, that you are not going to get, because their clinical experience which they have learned for 20 years, 30 years of their clinical practice, that is going to add a much more value other than the course curriculum. So that's how we have created a pool of faculty, and currently we have a pool of 500 faculty along with us all across country. It's not only diabetologists, but pulmonologists, cardiologists, retina specialists, gynecologists, and we definitely need funds to run that. Initially, we started getting the funds from the industry, and now you'll be surprised to know that various state governments have adopted these courses under their national health mission, and we are getting the funds from the respective state governments for these courses for their medical officers. So this is the various stakeholders in that. So we started with one in 2010, and we have now, we have now 11 initiatives with us. And if you see that, we thought these courses would be only for MBBS doctors with minimum 3 years of experience, but you'll be surprised that 40% of our doctors, those who have done, 23,000 doctors have already done all across country, they were having the postgraduate qualifications. So I'm not here to criticize our Medical Council of India. I'm not here to criticize our medical colleges, but I'm here to give you the update that physicians, I think we have picked up, there is a felt need to upgrade your knowledge, and this particular mechanism has fitted up very well to give the updations to the primary care physicians, even the MD doctors also, to get updated with the recent developments in the chronic conditions, treatments, guidelines, and everything with the help of the faculty. And you will see the average age of the physicians is 40 years. It's not the freshers, those who are joining these courses. 1/3 from the government doctors have joined that. Diabetes course, which has become the first IDF recognized course also. People are saying that it is not possible that IDF can come and they can, but I'll give you the history that IDF people came over to India to review this particular model. IDF president himself came, Sir Michael Hurst. He sat in one of the center, in one of the session, gone through the courses, whole material, they put it up to the committee, and the first course globally which got recognized was none other than but our certificate course in evidence-based diabetes management. So nothing is impossible, everything is possible if you have the commitment, if you have the passion to run in a systematic way. And now with that, what has happened is various other endorsement bodies have come up. Royal College of Physicians London, they have endorsed our CVD and CVD initiative. South Asian Federation of Endocrine Society, Asia Oceania Thyroid Association has endorsed first course in the thyroid sector was none other than, but the course which we are running in collaboration with Chelaram Diabetes Institute. It has been published into Lancet, it has been published into American Thyroid Journal, and these courses have won all the skill development awards in India, CAI, FICCI, PhD chambers, you name, everything is there in that. So this is in history now, that governments have started taking it over. You started for the private physicians, but the now state government, 13 governments have already taken it up. And today only the news have come up that women's health and thyroid course for 400 doctors, MP government has taken it over. So it means that government has also realized the value of the curriculum and the implementation strategies which how we are running, and they are taking it up in a big way. And next month we are expecting government of Gujarat to take it up in a very big way, and where we have already requested Dr. Abhichandani to lead that initiative for government of Gujarat. This is what PHF has given to the country. More than 530, you can say 581 districts, the manpower. Manpower means the physicians, those who have taken these trainings, they are spread to all across country. So at least you have updated those people. The people are available. You can get the treatment, you can get the things from them. And it is not only in tier 1, but equally in tier 2 and tier 3 cities. You started with 1, you have 11 courses. You started with 115, you have 581 districts now. You started with one state government, that is first government which has come up as Kolkata Municipal Corporation, and then followed by Kerala government, and now we have in 11. You started with India, and now these courses are running in 70 countries. Africa, whole Africa region, Nigeria, Nepal, Bangladesh, Myanmar, Afghanistan. So these courses have been adopted by them, and recently we did an MOU with the Ministry of Health of Rwanda. So they are adopted this initiative for their medical officers. So this is the state government's adoption in the different states, and courses around 1,200 medical officers have already been trained through these state governments' various courses. This is Government of Madhya Pradesh Principal Secretary, where she was highlighting this initiative in the Innovation Summit. This is the Mission Director of National Health Mission, Government of Tripura. They have made PHFI as a skill building partner, and our all courses are going on in Tripura in a very big way. Everybody said you do the courses, what is the impact? We got this impact letters, 2 letters, just last week only. One impact letter from Kolkata Municipal Corporation Deputy Mayor. What they have done is, Kolkata Municipal Corporation has taken up these courses for their doctors, and now, since 2013, we have the partnerships with them, and now what they are doing is, you just see the line, they are opening up 16 cardio-diabetes clinics into their respective corporation hospitals with the help of those doctors. And they said, our doctors are now equipped enough, and we want these doctors to run these, to deal with the various cardio-diabetes ailments. And this course was none other than, but the partnership course which we are running with Chilaram Diabetes Institute, cardio-diabetes. So that's how, this is the testimonial which we have received from Kolkata Municipal Corporation. The testimonial from the MD of NHM Tripura government. They said, lot of things are available, but these courses have really equipped our doctors, and we want more and more initiative with Public Health Foundation of India. So this is the impact in the health system, you can say. These courses we have a very strong monitoring mechanism. That is the reason for success also. We monitor the sessions, we take the feedbacks, and we collate the feedbacks with the help of observers. And those feedbacks we give to the national expert panel before the start of the next cycle, modify the course curriculum, update the course curriculum year by year. It is not the same which we are doing in 2010, the same thing is going on in 2019. And the best part is, these courses are all paid courses. If you start as a free, people will not take it as a value. It will be a free lunch. Nobody will value it. But we have put it up in amount in such a way that 20% of the cost we should recover from the participants, even after getting it from the funding partner. The purpose was the commitment should come. By keeping this, what we are getting is the compliance rate is more than 90%. People are coming from 200 kilometers, take the training, going back also. You name the awards, all the FICCI, SOCHAM, PhD, BMJ India, everything these courses have won as a skill development awards. These are the various awards. Our President and Vice President from the Honorable Union Minister, they are getting, Mr. Rajnath Singh is giving the highest skill development award to them. We got an award from SOCHAM as a skill development award from Pratapa Rudi. This is the highest quality award in India from Quality Council of India. For a quality-oriented implementation of these courses, we have received from Mr. Amitabh Kant, who is the CEO of Niti Aayog. This is the recent award, CAI and FICCI Excellence Awards, with this particular initiative I have received. This is another one award which we have received. It has been published into all eminent journals, as I told you also. Media coverages, huge media coverages all across country. During the certification distribution ceremony, I want to tell you one new thing. People have started, faculty have started calling the Honorable CM Principal Secretaries health secretaries, health ministers to come over and distribute the certifications for the participant. How it is happening? Because it's the ownership, they are acting as an ambassadors for these courses, and we are getting the opportunity through them to enter into the state governments and pitch with the governments. Why not? If private sector is taking it up, why not the government should take it up? This is it has won 2 innovative, consecutively it has been chosen as an innovation model by the Ministry of Health into their summit. Now, we have crossed the national boundaries, entered into Nepal, Bangladesh, Rwanda, whole African continent, Afghanistan, Myanmar, and these courses are running Bangladesh, and these courses are running successfully in these countries also. It is not that we are implementing, but we are conducting the TOT for their leaders, giving the modules free of cost, let them implement. So innovation can happen in India. It is not that innovations only happens abroad. Innovations you can create in India, and let the people should look after your India also. This is what we have given to them. This is the Ministry of Rwanda, Ministry of Health, which has signed an MOU with Public Health Foundation of India. This is our international expansion of these courses. These countries are in pipeline: Sri Lanka, Bhutan, Zambia, Jamaica, Maldives, and Thailand. Very soon the partnerships are going to happen, and these courses are going to spread to those countries also. We have also entered into another arena. Other than these courses, we have started another initiatives in management. XLRI is a very prominent name in the management sector in Jamshedpur. We did a partnership with XLRI. We thought we are good in health sector, Public Health Foundation. They are top-notch into health, into management. Why not 2 bodies join hands together? We are going to start 2 MDPs with them: health program management and monitoring and evaluation. This is for the program managers of the state governments, how they implement the course, how they implement their various state-run programs and other things. So we want to equip their, we did the partnership with National Institute of Occupational Health, Ahmedabad, to start a new initiative in occupational health for primary care physicians, because it's a niche area, neglected area, and nobody wants to enter into this also. Our upcoming initiatives are patient safety and communication. We are into a final stages with the Indian Institute of Science, Bangalore, and Indian Institute of Space Science Technology, which is the ISRO body, to enter a course on health technology also. Ma'am, e-learning initiative, it is your area which is coming up on an e-learning mode, because ultimately sustainability you need, global scale you need. We are coming up with the first e-learning course, that is diabetic retinopathy. Currently it is a contact-based session, but now we are converting into e-learning mode also. Hypertension course on an e-learning mode is coming up with American Heart Association. So plan is to expand more, to create real impact at the ground level, and to impart these teachings so that best to best and maximum doctors can take the benefit from that. This is the partnership which we have with Chelaram Diabetes Institute. We started in 2014, that is with advanced course in cardio diabetes, and with World Heart Federation as an accrediting partner. You can see how the process has started. There's a huge hard work at the back. It is very easy to see the modules and the running the sessions, but at the back it's a huge hard work which has gone. Creation of the modules, bringing the partners, then dedication of those partners in implementing the things. These are the few glimpses. You can see Dr. Unikrishnan and their group. This is a partnership model of, it's a 6 modular course, and this is a spread of the course in 52 centers, 39 cities, and around 2,000 doctors have already done these courses. Currently, the next batch has been announced. Already our colleagues are distributing the various pamphlets for this particular initiative. Our stall is there, and we are opening up 12 centers for this initiative this year also. And if you see the participants' profile, as I told you, it is all eminent physicians having the well-established clinics, hospitals, those who are taking these particular initiatives. And this particular cardio-diabetes course has been adopted by Myanmar, East African Diabetes Society, Kabul University, and Afghan Endocrine Society, Government of Tripura, Kolkata Municipal Corporation, not only in the private sector, but in the government sector and international arena also. This is our second partnership with Chelaram Diabetes Institute. That's a thyroid initiative. 4 modular course. This is a spread of the course in 49 centers, and this course got a great hit when it started, and around 2,000 doctors have already done this particular initiative. The plan is to have it on an e-learning mode also very soon. And if you see that, this course has also been adopted by various state governments and various other countries also. So it has been published into Thyroid Journal. We started with 2 partners only in 2010, that is PHFI, and we got the grant from MST when we started this. And this is the strength which we have created in 2019. So it is not only that one or two people, one person can do nothing. It is not that PHFI has created something unique history, but you people have given opportunity to PHFI to create this history because you people have believed on PHFI, you people have given opportunity to PHFI, and this is how the strength PHFI has created today. So this is the team of Public Health Foundation of India. These are our leaders, Professor K. Srinath Reddy and Professor Prabhakaran. And I'm really, we are lucky to have the leaders like that who has given you full flexibility. And this is the dedicated team of 54 people now. We started with 5 in 2010. Now we have around 55 colleagues working day and night for these initiatives. And the time has come that anything you need from us, you let us know where PHFI can help you. We are there to strengthen the public health system in India, and we will try our level best to give whatever best we can do for the Indian health system strengthening. So thanks for giving me this opportunity, and any queries, any questions, please.